How do you identify incoherence? Have you ever tried to follow a conversation that seemed to jump from topic to topic without any connection? This experience can be a sign of incoherence, especially in the context of schizophrenia. So, how do we identify incoherence? Let's break it down. Incoherence is a symptom often linked to schizophrenia and is a key feature of thought disorders. It refers to speech that lacks logical connection. When someone is incoherent, their thoughts may not flow in a way that makes sense. This can lead to communication that is hard to follow. One way to identify incoherence is by listening to speech patterns. If a person's speech is disjointed or lacks a clear structure, that could be a red flag. For instance, they might start a sentence and then stop abruptly or change the subject unexpectedly. Another aspect to consider is language use. Pay attention to whether the person is using nonsensical words or phrases. This might include made-up words or using familiar words in unfamiliar ways. If their language seems jumbled or confusing, it may indicate incoherence. Context is also important. Try to understand the topic of conversation. If the person's responses seem unrelated to what you are discussing, that could signal incoherence. For example, if you ask about their day and they start talking about a completely different subject, that might be a sign. It is also helpful to observe these patterns over time. Incoherence is not just a one-time occurrence. It tends to be a persistent pattern in someone's speech. If you notice this happening regularly, it may warrant further attention. In the context of schizophrenia, identifying incoherence is essential for diagnosis and treatment. Healthcare professionals use this information to understand the extent of the thought disorder. This can help them create appropriate treatment plans. For instance, speech therapy can be beneficial in improving communication skills and reducing incoherence. Incoherence often appears alongside other symptoms of schizophrenia, such as hallucinations or delusions. Recognizing these symptoms together can provide a clearer picture of the disorder and its impact on a person's life. By identifying incoherence and its manifestations, healthcare providers can tailor their approach to meet the specific needs of individuals with schizophrenia. This ultimately aims to improve their quality of life and communication abilities.